what a normal menstrual cycle is and which are the hormones that we should look for so that we can uh, understand how this whole thing works, and we can talk about the treatment options eventually.
Okay. So it's very important for every woman to know what is the so-called the right menstrual cycle. So I would like to say that there is nothing called the perfect or the right menstrual cycle. It varies from one person to another person. So there's nothing called as a 28-day cycle. A normal menstrual cycle could vary anything between, let's say, 22 to 35 days. And the flow also could vary anything between 2 to 7 days. But in case the variation occurs more than 8 days, now that is abnormal, which means earlier, if your period was 22 days and now it's coming to 32 days, now this is a problem. In case your earlier period was 40 days and now it is coming at 20 days, now that is a problem. That could be indicative of some other problem. And obviously, the period should not be really painful. Once in a while, little bit of pain is fine for every woman, but it should not be like a woman has to take 3-4 painkillers every day. So that's also not normal, and it could be indicative of an underlying problem. There should be no bleeding in between the periods. There should be no bleeding after the intercourse. There should be no bleeding after a woman has gone into menopause. So this is what is the definition of a normal menstrual cycle. Now, the periods don't just happen at the uterus and the ovary. Now it starts at the level of the brain. The entire story of the period starts at the level of the brain. So from a brain, so we have a gland called hypothalamus, then a pituitary gland. So from there, certain hormones are released. From the hypothalamus, then it acts on the pituitary. From the pituitary, then it acts on the ovary. And then finally, it acts on the uterus for the final periods to happen. So medically, you also know this is known as HPO axis, which is hypothalamic pituitary ovarian axis. So in case if there is something wrong here, now the periods are bound to be getting disturbed. So that's why when a woman is stressed, she has her exams, she has any kind of a stress which is bothering her there. The periods are the first thing which will get affected. So that's why, any kind of stress will affect your periods.
Is it common you see in your practice?
Very common, very common. In fact, the modern day women, in fact, the modern OPD today, I tell my juniors also, I'm a postgraduate teacher, that today gynecology practice has changed completely. Today, half of my OPD is filled with PCOD and endometriosis. It's like, what we read in our times has completely changed.
What were you seeing before?
So earlier, people were having, problems like heavy periods and, fibroids and other things. But today, infertility, PCOS, weight gain, hypothyroidism, these are the problems which are affecting modern women. 20 years back, hardly there were any IVF centers. Today, in modern metro cities, every nook and corner has a IVF center. So, that's how the entire physiology of this HPO axis has changed in modern times.
It's amazing. It's amazing.
Yes.
I remember when I was in medical school, when you do the gynecology rotations, right? Mm-hmm. So the only thing that they keep on talking about is fibroid. It was only fibroids. Only fibroids. PCOS, they will say it's a very rare disease.
So when I did my post-graduation, of course, that was way back in 91. So PCOS was a small chapter in our books. And we never used to read that chapter thinking that nobody's going to ask this question in the final exam. And today, the statistics say that 1 in every 3 to 5 women across the globe is suffering from some kind of manifestation of PCOS. It's like a gynecological epidemic. It's huge. Like 1 in every 3rd woman is suffering from this.
Wow. So, if my understanding is right, hypothalamic pituitary ovarian axis. If there is a disturbance in this connection, the reproductive hormones are not secreted properly.
Correct.
And that could be an initial manifestation of what we call as PCOS.
Yes.
So I'm going to tell you what my understanding of menstrual cycle is. Okay, I'm going to refresh my gynecology thing here.
Okay.
So let's take a 28-day menstrual cycle. The first 5 days is the shedding of the endometrium, which is a lining of the uterus, and it starts bleeding because the uterus is getting ready for conception, getting ready for possible fertilization.
Okay.
Okay.
Let me see how much of gynecology do you remember. Then I'll correct
So
it.
first 5 days, the endometrium is shed off.
Yes.
The next is a follicular phase where day 6 to day 14, your follicle stimulating hormone is stimulating the ovarian follicles to develop.
Absolutely. Correct.
And there is an ovum inside. It's
Yes.
waiting to come out
Yes.
at the day 14, around 14 day. That's where the another surge happens called luteinizing hormone, LH. Then after that, let's say that ovum is released. If it gets fertilized by a sperm, then pregnancy happens.
Correct.
If a sperm is not there, then it stays for like 10, 14 days. Then it disintegrates and then the endometrium sheds. Am I right?
By and
Overall.
large. By and large. So basically what happens is on day 1 or day 2 itself, a bunch of cohort of the tiny follicles, they start to grow in the ovary. Out of that, only one follicle gets selected. This is known as dominant follicle. Now, when that follicle is growing, it is secreting a hormone called estrogen. So now that estrogen starts to stimulate the endometrium in the anticipation of the pregnancy. So when the estrogen levels, they reach a particular point, now, this triggers a process of ovulation. So this is known as a positive feedback loop. And then the ovulation happens. After the ovulation, the egg is live inside only for about 48 hours. In case the fertilization happens in this window, great. Otherwise, everything goes waste. So supposing if the fertilization happens, now the egg stays live, the levels of estrogen are there, the progesterone also comes in, and then finally the periods don't happen because there is no withdrawal. But in case the pregnancy does not happen, the estrogen levels come down, the egg dies, the progesterone also come down. Now endometrium has no support, so it sheds in form of a period. Now today, most of the women have a lot of, I would not say most, but many of the women suffer from what is known as anovulation. So the cycles are not ovulating. I mean, I always say, why is the damn ovary not ovulating? It's like the primary function of the ovary is to ovulate. But why is the ovulation not happening? Because of multiple factors, because of disturbance at the level of the HPO axis, because of insulin resistance. I mean, we have a lot of theories now coming up, high insulin levels, high cortisol levels, less melatonin levels. Melatonin is very good for ovaries. The imbalanced cortisol and melatonin affects the ovary, doesn't let the ovulation to happen. Then, of course, obesity, bad diet, hypothyroidism, autoimmune, all these things, they disturb the ovulation. That's the reason women are not able to conceive, So multiple problems happening because of the modern day lifestyle. So in fact, I tell this to everyone that we are actually paying the price for being modern in our lifestyles.
Right, of course. So the underlying problem is the ovum needs to be coming out of that dominant follicle.
Correct.
That needs to happen.
Ovulation needs to happen at the right time. And after that also, see, for the pregnancy, it's not just the egg and the sperm. There are a lot of things which happen around these two guys to make the right things happen. So, we need to have the right luteal phase, the optimum level of the progesterone. In case the ovulation is not synchronizing with the endometrium, then, ovulation might happen early, the endometrium is not ready. So all that, the problem is basically is the hormones are not functioning the way they should. So that's the biggest problem today.
Among the estrogen and progesterone, which is the hormone that you think that is very important?
Both of them.
Both of them.
I mean, both of them, they have their own function, I mean, there can't be one favorite. Both of them are important.
So you need both to be working 100% quality.
Yes.
And both are under the control of this HPOA axis.
Yes, by and large.
By and large. So when there is any disturbances, then let's say the discussion that we had in the first 14 days, let's say there is any disturbance, maybe the estrogen is not secreted properly, or even after at the time of ovulation, maybe the hormones are not secreted properly.
So I'll give you, an example. For example, PCOS. In PCOS, what happens, as the name suggests, polycystic ovary, which means that you have multiple tiny cysts in the ovary. Now, these are not really cysts. These are a bunch of those small follicles which they are developing, but none of them is good enough to finally develop into a dominant follicle and ovulate. But all of them are secreting bits of estrogen. So there is so much of estrogen, a lot of them are developing, but none of them finally ovulates. So there are multiple things which happen wrong in case, our hormonal profile is not
Optimal.
optimal.
Not optimal. So if you say that, let's say if this HPOA axis is acting super, no problem at all, then all these issues will come down.
So, we as doctors, we know that everything is interconnected. It's not, we cannot say just the hypothalamus and pituitary. For example, somebody is obese, somebody who has a lot of stress, she'll have a lot of cortisol. She's not sleeping properly. She'll have less melatonin. So even if things for some time are fine at this place, probably the end result may not be the right thing. So there are multiple things, like hormonal system is not just about hypothalamus and pituitary. There is a thyroid, there is adrenal. So, everything has its own role. They're all interconnected.